this video, let us see about alcohol poisoning. Alcohol belongs to invariant group of neurotic class of poison. This inherent is a common term used for the preparation which is having alcohol in it and which can cause addiction liability in a person. Inherent poisons are those poisons which intoxicate and produce symptoms of excitement and narcosis. Examples of beverages and percentage of alcohol present in it. Rum, whiskey and brandy which having 43% of alcohol, wine 8 to 15% of alcohol and beer 2 to 10% alcohol. The inherent are the substances that induce intoxication and inebriation, and it includes mainly alcohol, barbiturates, benzodiazepines and even chlorohydrate which can cause addiction liability in a person. Coming with the types of alcohol, we have ethanol, also called as ethyl alcohol, grain alcohol. Methanol is called as methyl alcohol, wood alcohol. Isopropanol is also called as isopropyl alcohol, rubbing alcohol. And we have ethylene glycol. According to the syllabus concern, so we will be talking about ethanol and methanol poisoning and its management. This is a general picture of methanol poisoning. What is the significance of poisoning and the impact? When methanol is administered, so it will be acted upon by alcohol dehydrogenase to produce formaldehyde, and further this formaldehyde will be acted by aldehyde dehydrogenase to produce formic acid. This formic acid raises the pH towards acidic. So acidosis can be observed, which can directly participate for the ocular toxicity, and this acidosis condition can cause inhibition of the mitochondrial respiration, thereby tissue hypoxia can be observed, so thereby symptoms of general toxicity will be observed. In hypoxia condition, lactic acid production can be seen, which can contribute for acidosis condition. This acidosis can also cause a circulatory failure, so thereby tissue hypoxia can be observed. So this circle is called as circulus hypoxicus. So then coming with the route of administration, if alcohol is administered either in topical inhalation, even intravenous injection or oral injection. Absorption and distribution. Absorption of ethanol is by simple diffusion. 25% of ingested dose of ethanol is absorbed from the stomach, a little percentage when compared to the small intestine, where 75% of the alcohol will be absorbed from the small intestine. These are the factors affecting the absorption. As it's a diffusion, concentration gradient, the presence of food in the stomach can interfere, and also health status of the stomach, rate of emptying of the stomach, rate and quantity of alcohol ingested, and also tolerance, which is differ with different people. Distribution of alcohol, as alcohol is hydrophilic and can distribute into the fluids as well as tissues according to their water content. Total body water is dependent on age, sex as well as body weight. Alcohol can cross placenta as well as blood-brain barrier. Then coming towards the fatal dose, logically if you see, there is no specific fatal dose of alcohol because tolerance individually it varies. So it's a blood alcohol concentration, so that specifies the lethal dose. It may be more than or equivalent to 350 milligram percentage. Coming to the fatal dose, it may get vary person to person. It is observed less in the case of thin and lean person, females, mentally unstable subjects, patients suffering from liver disease, epilepsy, cerebral trauma, a patient using barbiturates, antihistamines, tranquilizer and hypnotics, where it may be less than 350 milligram percentage. So it may be more in the case of tolerance people. Then coming with the fatal period, so relatively it is more than 12 to 24 hours, or sometimes it may extend up to 5 to 6 days. This is the stage of alcohol intoxication. See, we can observe according to the milligram percentage in the body, we can see three stages here: stage of excitement, stage of incoordination, as well as stage of narcosis. If alcohol present in the range 30 to 100 milligram percentage, stage of excitement can be seen, where increased tachypneus can be observed in the person, increased self-confidence, decreased sensory perception, loss of fine motor skills can be observed. Even slowed information processing and increased sexual desire can be seen in 30 to 100 milligram percentage. And coming towards the range 100 to 300 milligram percentage, where stage of incoordination can be seen, incoordination of thought, speech, impaired judgment, confusion, slurred speech, clattering gait can be observed. When nausea, vomiting, dilated pupils, then even criminal offences are committed in this range. And now, if the concentration is more than 300 milligram percentage, stage of narcosis, where deep sleep, rapid pulse, hypothermia, even labored breathing, contracted pupils, even MAC1 sign can be present, coma and death can be observed in the concentration where more than 300 milligram percentage. Then coming towards the laboratory test for diagnosis of alcohol poisoning, a blood test can be done, vitreous fluid can be checked, even also urine analysis can be done for laboratory investigation. Then coming with the effect of alcohol on driving, driving inability is affected by 50 to 60 milligram percentage, where the driving ability will be impaired, where faulty depth perception can be observed, when poor peripheral vision, distorted color vision, reduced night vision, and increased reaction time can be seen. This is the effect on driving. When diagnostic test, finger nose test can be done, or straight line test can be informed. Even breath analyzers can be used in order to check the alcohol concentration. Then coming towards the treatment of poisoning, where two possibility. Let us see the treatment in hospital. Gastric lavage technique can be helpful in the removal of unabsorbed poisons. When artificial breathing, whenever required, it can be included. And monitoring of electrolyte imbalance should be done. Urinary catheter can be placed for removing of the alcohol. Even IV hypertonic glucose solution can be given if severe hypoglycemia is observed. Fructose solution can be administered. And hemodialysis and peritoneal dialysis can be preferred if alcohol or observed. And coming towards the effects of chronic alcohol poisoning on the body, causes liver cirrhosis, physical, moral and mental deterioration, chronic gastroenteritis, weight loss, peripheral neuropathies, impotence and sterility can be observed as a chronic effect. Coming with the common clinical syndromes, so delirium can be observed in the acute attack. So even tremors, excitement, fear, hallucination, even auditory hallucinations can be observed. Even patient may become homicidal or sometimes suicidal tendencies can also be observed. Then coming towards the course of psychosis, hallucination, disorientation, multiple neuritis, loss of memory for the recent events can be observed as a clinical syndromes. And coming towards the treatment of chronic alcohol poisoning, anti-abuse treatment can be started by giving disulfiram. As you know, this disulfiram is going to block the metabolism of alcohol. So it can be given in a dose of 0.5 mg. Given tablet, citrated calcium carbamate, So it can be given in dose of 50 mg followed by psychotherapy. So let us see in general about the types of alcohol. So these alcohol are actually derivatives of hydrocarbons. There are three categories of alcohol: monohydroxy alcohol, dihydroxy alcohol, trihydroxy alcohol. The monohydroxy alcohol, ethanol, methanol and isopropanol are the example. Dihydroxy alcohol consists of glycols, ethylene glycol. Trihydroxy alcohol, so they are not really alcohol but only derivatives like propane derived from glycerol or glycerin. This ethanol is also called as grain alcohol. Coming to the physical appearance, a very clear colorless liquid with a fainty fruit odor and sweetish burning taste. It's both water soluble and lipid soluble in nature. Coming towards the source, ethanol is produced mostly by the synthetic production from ethylene. Fermentation of sugar, cellulose or starch. The method is used in the production of beverage. Alcohol, enzymatic hydrolysis of cellulose can also produce anhydrous ethanol. Even azeotropic distillation method can be used. And beverage ethanol is produced by fermentation of sugar from various cereals, vegetables or fruits with help of yeast. Uses beverage purpose is used. Popular alcohol beverages which include beer, wine, whiskey, gin, brandy, rum and vodka. Solvent after shave lotions, deodorants, mouthwashes and perfumes. Coming towards the medicinal uses of alcohol, several antihistamines, decongestant, multivitamins and cough syrup preparation, so it will be having 2 to 25%. Ethanol has been popular in the past as an antiseptic. In the form of solution it was available. Ethanol sponging is an effective remedy for hyperthermia. When injection of dehydrated alcohol, that's absolute alcohol, relief of long-lasting pain in conditions such as trigeminal neuralgia condition. And it's also act as an antidote for methanol and ethylene glycol poisoning. As a preservative, it can be used. Rectified spirit, 90 to 95% of ethanol is used as a preservative. And also for many chemical analysis, it can be used. It's also used as a fuel. Ethanol is used to extract nucleic acid from whole tissue or tissue culture in virtually in all biotechnology process. So conclusion about the user fatal dose: 1 pint approximately 550 ml or quart 2 pints or approximately 1100 ml of strong distilled spirits such as whiskey taken in short span of time can be lethal. The usual fatal dose corresponds to the approximately 6 grams per kg body weight in adults, 3 grams per kg in children. Blood alcohol, a level excess in 400 to 500 mg per dl is usually considered to be lethal. But once again, tolerance matters. It depends on the individual person.